Ebola virus disease, or EVD, is a serious illness. It often leads to death. Ebola can cause outbreaks that are hard to control. The virus first appeared in 1976. It was found near the Ebola River in Africa. Ebola is a hemorrhagic fever. This means it can cause bleeding inside and outside the body. The virus damages blood vessels. It also affects the body's ability to clot blood. There are 5 known species of Ebola virus. Only 4 cause disease in humans. The most deadly species is Ebola virus, also known as Zaire Ebola virus. Ebola outbreaks typically occur in Africa. The disease can spread quickly from person to person. It requires immediate medical attention. Ebola spreads through direct contact. This includes contact with the body fluids of an infected person. These fluids include blood, saliva, and vomit. The virus can also spread through objects. Contaminated needles or medical equipment can transmit the virus. Contact with infected animals is another way Ebola spreads. Bats are considered a natural reservoir for the virus. The incubation period for Ebola is 2 to 21 days. This is the time between exposure and the appearance of symptoms. Early symptoms resemble other illnesses. These include fever, headache, muscle pain, and fatigue. As the disease progresses, symptoms worsen. Patients may experience vomiting, diarrhea, and abdominal pain. A rash, red eyes, and hiccups can also occur. In severe cases, internal and external bleeding may develop. Diagnosing Ebola quickly is crucial. Several methods are used to identify the virus. Polymerase chain reaction, or PCR, is a common test. It detects the virus's genetic material in blood samples. Another method is enzyme-linked immunosorbent assay, or ELISA. This test detects antibodies produced by the body in response to the virus. Virus isolation is a more specialized test that involves culturing the virus from patient samples. Treatment for Ebola is primarily supportive. This means managing symptoms and complications. Patients receive intravenous fluids to combat dehydration. Medications are used to control fever, pain, and vomiting. Experimental therapies are being explored. Monoclonal antibodies such as Inmazeb and Ibanga have shown promise. The Ervebo vaccine, while effective for prevention, is not useful for treatment. Preventing Ebola outbreaks requires a multi-pronged approach. Vaccination is one important measure. The Ervebo vaccine is effective against the Zaire species. However, it does not protect against the Sudan species. Infection control practices are essential in healthcare settings. These include wearing appropriate personal protective equipment, or PPE. This consists of gloves, gowns, masks, and eye protection. Proper handling and disposal of medical waste are also crucial. Avoiding contact with infected individuals is paramount. People who have been exposed to Ebola should be isolated. They should be monitored for symptoms for 21 days. Safe burial practices are important to prevent transmission after death. Public health education is key to prevention. Communities need to be aware of the risks of Ebola. They need to know how to protect themselves and others. Rapid response to outbreaks is critical to containing the spread of the virus.